If you still have to take your med-surg nursing class, you need to know about oncotic pressure, at least before you get to your burns unit. If you can learn this when you're still in fundamentals of nursing, even better, because it's useful for fluids and electrolytes too. Look at my captions for how to spell this word, because it is kind of a weird word, although it's a lot of fun to say for some reason. And it's one of the 4 things that you have to know about fluids and electrolytes to be successful in nursing school. Not quite as important as osmosis and diffusion, but still a decently major player. Oncotic pressure is kind of like the magnetic pull that proteins have on water. So when I did my osmosis video, we said water wants to dilute stuff. So it'll move towards stuff that needs to be diluted. It's the water doing the moving though. Here, it's still the water doing the moving, but instead of wanting to go do something, it's being pulled by the protein. Now, albumin is the most common protein inside the blood vessels. So it's the biggest player when it comes to oncotic pressure too, at least related to blood, which is often what we're studying in nursing school. Now in med-surg, when you get to burn injuries, oncotic pressure becomes very important because normally the blood vessels are not permeable to albumin. Basically, the albumin is too big to leave the blood vessels. So it usually helps keep water inside the blood vessels, and this is good. But when you have a severe burn injury, this just messes a lot of things up, obviously. And one of the things that it messes up is the permeability of your blood vessels. Basically, the floodgates get thrown open, and it is now permeable to things that it should not be permeable to, including albumin. And the albumin flees, starts moving out of the blood vessels into the interstitial spaces. So what does the water do? It follows because of oncotic pressure. Obviously, this is a bit simplified, but it gives you the basic idea, and it's definitely enough to get you confidently through nursing school. Knowing this foundational information, you can use the Silver Bullet study system, which is my 4-step study method, and you can get a free 10-minute overview video in my bio link if you want to learn more about it. But you can make predictions about what's going to happen and what kind of nursing care you're going to do as a result. Notice I said predictions, not memorization. You can actually understand this stuff in the way an experienced nurse will when you study with my Silver Bullet study system. So anyway, if the albumin's leaving the blood vessel, if the water's following it, obviously there's not going to be enough water in your blood vessel. Your blood pressure is going to tank and you go into circulatory collapse, shock. And one of the treatments they're going to give you in the acute phase is albumin to try to replace what your blood vessels have lost, with the hopes of kind of attracting some of that fluid back into the blood vessels. And they're also obviously going to give you more fluid in your blood vessels too. Make sure you bookmark this video so you can come back later when you need the oncotic pressure explanation again.